Okay, Dr. RJB, I wanted to talk a little bit about back surgery. Um, now, uh, you know, um, uh, there are a lot of people with back problems, um, but not everybody needs to have back surgery. Um, and the thing is that most of the problems that we see with back are problems with pain, and most of the problem, is related to problems with the muscles. Um, there can be stiffness, there can be discomfort, but not necessarily any reason to do surgery for those kind of things. As a matter of fact, doing surgery probably is not going to change anything. Surgery in of itself can cause discomfort, and so if you have back pain and you're using that as a reason for surgery, you're probably going to still have back pain after you're done with the surgery. But there is a reason to have back surgery that will actually do some good. If you have a problem where you have a nerve that's being injured because of a herniated disc, that's a good reason for having back surgery done. If the surgeon can remove the disc away from the nerve, take the pressure off the nerve, that nerve is going to be healthy and it's going to function better. In some cases, you have a disc that's herniated and it's pushing against the spinal cord, causing the spinal cord to have trouble transmitting the impulses from the brain. Again, a good reason for having surgery done, in that case. The patient who comes in and they're having a difficulty walking because of pressure against the nerve, if we can identify that problem with the MRI scan and we can see that, there's a nerve being injured, doing surgery to remove that, disc away from the nerve can be helpful. In some cases, the nerve is being injured because of arthritic changes, where the nerve, as it leaves the spine, is being pinched. And again, they can open up that area with surgery, and again, allow that nerve to function more properly. There's also a condition called spinal stenosis that might require surgery. Spinal stenosis is a situation where there's crowding of the area around the spinal cord, and the surgeon can open up this area surgically and take the pressure off the spinal cord. In this kind of a condition, moving causes a lot of discomfort and can also cause, nerve sensations going down the legs with spinal stenosis. Because of pressure against the spinal cord, the nerve impulses are not being transmitted properly, so you might feel tingling, numbness in the legs with this kind of condition. Again, by doing surgery to open up the area and take the pressure off the spinal cord, this kind of problem can be aided. So these are the big reasons for doing surgery. Is whenever there's a nerve that's being pinched or compressed, taking the pressure off the nerve can be, a helpful thing. If we're just talking about stiffness, arthritic changes, some other things that are not to do with the nerves, the odds that the surgery is going to be helpful is not as high. That is a situation where, like I said, if it's more related to just discomfort of the back, it's unlikely that the surgery is going to change too much. Because surgery causes scar tissue, causes sometimes some instability issues, it's hard to say whether that's going to really be any different after the surgery, any different from what it was before the surgery. So, the time when it's advisable to talk about surgery is when we're talking about function. You're having trouble walking, you're having trouble whenever you do things like bending, etc. That's when you can achieve something, to benefit you after the surgery. But again, if it's just about pain, then pain medications, steroid injections, things like that should be tried instead of just going for surgery. Because we have the MRI scan these days and we can see what's going on with the soft tissues, it kind of helps us these days to determine whether surgery is going to be beneficial. In the old days, when we only had x-rays to look at the bones, we had to make interpretations sometimes, and it could be that we're made the wrong choices in those cases. These days, they probably are not going to be able to do a surgery without that MRI scan. Now, there is a benefit with physical therapy. In some cases where the injury or damage is not so great, doing physical therapy to help reduce swelling, to strengthen the back, sometimes that's all you need, and you can avoid surgery by doing it that way. So it just depends on what the kind of problem is, and how bad the things look on MRI scan, whether surgery is a good idea or not. So it's one of those things where you have to talk to the orthopedist and get their feelings and then make a decision for yourself whether surgery is going to help you. Okay, take care.